Okay, so we're going to discuss anemia. So in this discussion, we're going to use a question. So it's a past question on anemia. So the question reads: Mrs. Mwanza, aged 29 years, has been brought to your medical ward for admission with the provisional diagnosis of severe iron deficiency anemia. A1 is saying define anemia, that's 5 marks. A2, that's state 5 causes of iron deficiency anemia. B, state 5 specific signs and symptoms of iron deficiency anemia. C, discuss the management of Mrs. Mwanza under the following headings: 1, medical management; 2, nursing management. Then D, state 5 complications of anemia. So first question, it says that define anemia. Define anemia, 5 marks. Okay, so anemia is a condition in which there is reduction in the oxygen carrying capacity of the blood as a result of fewer circulating erythrocytes than normal, or a decrease in the concentration of hemoglobin characterized by pallor, fatigue, and headache. So a person with anemia, you find that they have fewer circulating red blood cells that are far away from normal, okay? And in most of the times they don't have enough hemoglobin in the blood. So a person is said to have anemia when the hemoglobin concentration is below 13.5 grams per deciliter in an adult male and 11.5 grams per deciliter in females. So that's how you define anemia. So you can define anemia as a condition in which there is a reduction in the oxygen carrying capacity of the blood as a result of fewer circulating erythrocytes than normal. Okay, and it is characterized by pallor, fatigue, and headache. Okay, then A2 says state 5 causes of iron deficiency anemia. So 5 causes are needed. State 5 causes of iron deficiency anemia. Okay, so the most common causes of iron deficiency anemia includes chronic hemorrhage. Okay, so this chronic hemorrhage can be due to peptic ulcers, hemorrhoids, hookworms, carcinomas of the rectum, the colon, and the stomach. Another common cause can be malabsorption. This can be due to chronic pancreatitis or any intestinal diseases. There is also dietary deficiency of iron-containing foods such as meat, liver, and eggs. Also, frequent pregnancies. When there's a lot of someone has frequent pregnancies, what you're going to notice is that there's going to be an increased demand for iron during pregnancy and lactation. And remember, a fetus takes mostly much of the maternal iron. Okay. Another cause is lack of hydrochloric acid. Okay, so those are the are the main causes or the common causes of iron deficiency anemia. Okay. Okay, so question B. Question B reads that state 5 specific signs and symptoms of iron deficiency anemia. That is 15 marks. Okay. So one of the specific signs and symptoms of iron deficiency anemia is fatigue. Okay. So fatigue is due to reduced energy and oxygen, since iron is also involved in the conversion of blood sugar to energy. Okay. Then there is changes in the fingernails, where you notice that the fingernails are going to be brittle, they're going to be discolored, they're going to be concave, or they're going to have a spoon shape. Another specific sign and symptom is you're going to find that there is a soreness and inflammation of the mouth and tongue. This can be due to reduced production of new cells and amino acids. There is also dysphagia, which is due to oesophageal atrophy. There is also pica, which is eating of strange things such as charcoal, or foods in great excess. Okay. Yeah. And in most of the times you find that these people, they eat tomatoes or any greens, okay, due to lack of iron. Okay. So those are some of the specific signs and symptoms. Remember, the question says state 5 specific signs and symptoms, and these ones are the specific ones. So soreness and inflammation of the mouth and tongue, changes in the fingernails, dysphagia, pica, and also fatigue. Okay, so the next question, C, which is C. Discuss the management of Mrs. Massa under the following headings. That is 1, medical management, then 2, nursing management. Okay, so whenever you're doing any management, you should have aims. So the aims for the medical management is to identify the cause of the disease, to promote adequate formation of blood cells, and also to prevent complications such as heart failure. Okay. After you write your aims, then you talk about the investigations that you're going to do. So history taking will be done to determine the possible cause of the disease, and also to identify the symptoms that are experienced by the patient. Okay. So there may be issue of blood loss, low iron foods, and also worm infestation. After you do your history, then you do physical examination. So physical examination will be done to establish the signs of the disease, such as pallor. Then a full blood count will show decreased number of circulating erythrocytes. Okay. So a full blood count will show decreased number of circulating erythrocytes. Okay, so under the same hematological studies, you notice that the serum iron and the total iron is going to be very low. Then the blood fumes that you're going to do, they're going to show megaloblastic changes in vitamin B12 deficiency and folic acid deficiency. Then the hemoglobin levels will be low. Then you get stool from the patient, where you're going to do stool for microscopy and occult blood. The reason you're doing this is to rule out worm infestation and any GIT bleeding. Then you can also do blood smears for malaria parasite. Okay, so now after you do these investigations, you're going to do the treatment. Okay, you go to the treatment. So the treatment is according to the cause. Okay, anemia treatment, most of the treatment they are due to the cause. So you're going to give ferrous sulfate 200 milligrams 8 hourly for 1 month. Now you should take note that the side effects of this drug might be constipation, diarrhea, nausea, vomiting, heartburn, stomach pain, dark colored stool or urine, okay, or temporal staining of the teeth. There could be headache. So these are some of the things that you should tell the patient to say, should you see these things, they're just side effects of the drugs, but it's normal, they'll subside. Then another drug that you can give is folic acid. So folic acid, that is 5 milligrams once per day for 1 month. Okay, so all these drugs you are giving them through oral, so the route is oral. So the side effects for folic acid includes constipation, diarrhea, stomach cramps. Okay, so these may occur. So make sure that you also inform the patient. Now, apart from these drugs, the other thing that you can do, non-pharmacological treatment that you can do is you can you can put the patient on oxygen therapy. Okay, so you can do oxygen therapy, that is if the patient is hypoxic. Then surgical treatment that you can give is a bone marrow transplant, especially if the patient has aplastic anemia, you can do that. Then blood transfusion is also essential. Okay, you can do blood transfusion, that is if the cause of anemia is hemorrhage. Make sure that blood transfusion should be among those. So that marks the end of medical management. Okay, so now let's go to the nursing management. So like I said, for every management that you're doing, you should have the aims or the objectives. So the aims for the nursing management is to increase the oxygen carrying capacity of blood, also to reduce the demand for oxygen. You can also to alleviate the discomfort experienced by the patient, also to help the patient to live a life that is as useful and satisfying as this condition will permit when the disease is chronic. So after you write your aims, then you talk about the environment. Okay, so the STEM question already said that this patient was admitted in the medical ward. Okay, so as you're writing the environment, you talk about nursing the patient in a medical ward. Okay, if you want, if you prefer, make sure that you nurse the patient in a side ward. Most importantly, the reason you're doing it is to protect the patient from infection, since the immunity of the patient is compromised due to the illness. Okay, and also you make sure that the room where you're keeping the patient is warm. So if there is a heater there, make sure that you switch it on. The whole reason why you're doing that is to prevent hypothermia. Okay, because you understand that anemic patients usually they have less body heat as a result of a reduced amount of oxygen available for metabolism. Okay, and also you need to make sure that there is good ventilation in that environment, so that you promote free circulation of air, and make sure that the environment is quiet to promote rest, and also to prevent nosocomial infections by making sure that the environment is clean all the time. Okay, so that's what you need to, those are the points you need to include on environment. After the environment, you talk about the respiratory care. Okay, So since this anemia, according to the STEM question, is it's severe iron deficiency anemia, so you will expect the patient to have shortness of breath or dyspnea. So what we are going to do is to make sure that we put the patient in a very comfortable position, or we elevate the bed, okay, to preferably a semi-fowler's position. The reason we're doing it is to promote full lung expansion and also to relieve dyspnea. Okay. Now, if the dyspnea is present with the patient at rest, make sure that you administer supplemental oxygen so that you improve oxygen tissue perfusion. Okay. You can also arrange for blood transfusion of packed cells. Okay, since the patient is has severe anemia. Okay, the reason you are arranging for that, because that is going to increase the oxygen carrying capacity of blood and also improve breathing. So as the condition improves, make sure that you let the patient adopt any position of comfort so that you promote rest. Okay, so now after you're done with the respiratory care, then you look at rest. Okay, so you need to put the patient on bed rest until the red blood cells and the hemoglobins are increased in order to reduce the demand for oxygen and conserve energy. Also, you need to promote rest by ensuring that the patient is comfortable in bed, and also restrict visitors and do all the related nursing procedures at the same time, so that the patient is not disturbed unnecessarily. Okay. Also ensure that those squeaking trolleys are oiled to prevent noise and hence promoting rest. Okay. You should also provide an explanation about the source of fatigue and weakness to create awareness and gain cooperation of the patient. So as a patient will be on bed rest, the patient is likely to have a pressure sores, especially on the sacral area. Therefore, make sure that you use the air ring to prevent pressure sore formation. Okay, excuse me. So after you do all these things, then you look at the observations. You talk about the observations. So you need to start doing observations on this patient. So on admission, make sure that you do the vital signs. Okay? You do the vital signs observation of that is the temperature, pulse, respirations, and blood pressure, which are going to act as baseline data. Okay? The reason you're doing that is so that you know if the condition is improving or deteriorating. Okay, then you can also do now subsequent vital signs every 4 hours to monitor the patient's condition and response to temperature. So a high temperature will be indicative of presence of infection, and you need to make sure that you work hand in hand with the physician to do further medical investigations to identify the specific infection. Okay, make sure you also observe the color of the conjunctiva, the lips, the tongue, and the other mucous membranes, so that you assess the degree of pallor, whether it is reducing or not. Okay. Also, you can observe for the presence of jaundice, which may indicate that there is hemolysis of red blood cells. Okay. Make sure that you evaluate the patient for presence of edema, which may indicate protein deficiency or onset of complications such as heart failure. Make sure that you also monitor urine output hourly and take note of the changes in color and volume of the output. So oliguria will indicate decreased renal perfusion, and you need to make sure that you notify the physician for further investigations to be done. So you can do many more observations. Remember, we've talked about giving oxygen, so you need to observe whether the pulse oximetry, the saturation, the oxygen saturation levels have increased. So these should fall under the observations. Okay, after you do that, then you talk about promoting the patient's comfort. So the patient with anemia, you find that frequently they experience severe headache and dizziness as a result of cerebral hypoxia. Therefore, you need to relieve the symptoms by encouraging the patient to remain quiet and inactive, and also reduce environmental stimuli such as bright light and noise to prevent stimulating the headache. And also you can apply cold compression and give prescribed analgesics such as paracetamol to relieve headache. Okay, after you talk about promoting the patient's comfort, then you can discuss the psychological care that you're going to give to this patient. And obviously you know that this patient is anxious because of the breathlessness which is there, and also there might be also chest tightness, and of course they are worried about the outcome of this condition. Therefore, you need to assess the patient's level of anxiety so that you know where to start from. Make sure that you provide adequate information about the condition so that you increase the awareness about the condition and thereby relieving anxiety. Not only that, you need to encourage the patient to ask questions to relieve psychological tension and answer the questions accordingly and honestly. You also need to encourage the significant others. Okay, so you need to encourage the significant others to stay with the patient to promote a sense of belonging, and thereby you're relieving anxiety. Not only that, you can make sure that you offer diversional therapy to the patient to take the patient's mind from thinking about their condition. Okay. Okay, so after you do the psychological care, then you can talk about nutrition and fluids. Okay, so on this one, you make sure that you need to make sure that you assess the nutrition and fluid status of the patient. Okay, the reason you are doing that is so that you know the interventions that you're going to put in place. Okay, you also need to encourage the patient to eat foods which are high in iron. Remember, this is a patient which this is a patient who has iron deficiency anemia. So in their nutrition, make sure that they eat a diet which contains high iron. Not only that, make sure that it has a lot of nutrients so that they can meet the daily nutritional demands and prevent malnutrition. Okay. Not only that, you should also know that a high nutritious diet can promote also formation of red blood cells. Okay. You should also ensure that the diet is light. Okay. It is light and easily digestible. Okay. And make sure that the foods that you've selected, they contain a lot of proteins, vitamins, iron, and of course other elements which are necessary for the production of red blood cells and hemoglobin. Okay, you also need to discuss the importance of foods with the patient. Okay, in increasing the red blood cells and hemoglobin, and also to determine the patient's food preferences. Okay, you should also offer small but frequent meals so that you encourage the patient to eat. And if the patient's mouth, tongue, and esophagus are sore, roughage and hot and spiced foods, you need to make sure that they are avoided. Okay. The reason you are avoiding them is to prevent irritation and trauma. You should also ensure that you wash the patient's mouth regularly and serve the food in a clean environment. You are doing all this so that you can promote appetite. You also need to encourage the patient to take adequate fluids to prevent dehydration and constipation. So those are some of the points that you can include on nutrition and fluids. Then you can talk about medications after that. So on medication, just where you talk about administering the prescribed drugs and fluids, such as blood to increase fluids such as blood to increase the hemoglobin and the oxygen carrying capacity of blood and promote healing. Okay. You also need to make sure that you monitor the patient for the effects and side effects of the medications that are administered. Okay. That is on medication. Of course, if you find other points, make sure that you include them. After you talk about the medications, you can talk about hygiene and infection prevention. Okay. One thing that you need to know is that hygiene is very important in preventing infections and promoting comfort of the patient. Therefore, in this acute phase of the disease, which is severe anemia, when the patient is on a total bed rest, what you need to do is that you need to make sure that you do a bed bath on the patient so that you remove the dead epithelial cells and also promote the patient's self-esteem. Okay. Now, as the condition improves and the patient is free from dyspnea, make sure that you provide assisted baths and also encourage frequent oral care to prevent halitosis and oral infections. And since a patient with iron deficiency anemia may have stomatitis and a sore tongue, make sure that you use a soft Bristol toothbrush to prevent oral trauma, which may predispose the patient to oral infections. Okay. Now, the mouth should be cleansed before and after taking food. You also need to make sure that you do nail care. You're doing nail care to prevent skin damage. Okay. You're doing nail care to prevent skin damage, which might lead to auto infection. Okay. You can also do area care to prevent breaking of the skin, since edematous tissue is reliable to break down. And you also need to do a two-hourly change of positions to prevent prolonged pressure on bony prominences. Okay. Also, since we're talking about hygiene and infection prevention, you need to make sure that you restrict visitors and other personnel with any infections, such as a cold or a sore throat. You restrict them to be in contact with the patient so that you prevent cross infection. After you talk about hygiene and infection prevention, then you can talk about exercises. So initially, since the patient is on bed rest, during this time you need to help the patient to do passive exercises to improve blood circulation and muscle wasting. Okay. You also need to help or to assist the patient with a range of motions to prevent bed rest complications such as deep vein thrombosis, which can be due to vascular congestion. You also need to introduce activities slowly to the patient as the patient's condition improves, so that you prevent straining the heart. Okay. After I talk about exercise, then you need to talk about the eliminations. So under elimination, you need to monitor the patient's elimination pattern in terms of urine and stool to detect any abnormalities such as reduced urine output, constipations, and diarrhea. So if the patient is constipated, make sure that you encourage the patient to increase foods rich in fiber to relieve constipation, which may lead to straining of the heart. Okay, so partly that is the nursing management and the medical management that we've just looked at. Now let's look at this question which says state 5 complications of anemia. State 5 complications of anemia. So one of the complications of anemia is congestive cardiac failure. Okay, this can be due to increased workload of the heart to pump more blood in order to meet the metabolic needs of the body. Another complication is respiratory failure. This can be due to severe hypoxia. Another complication is respiratory acidosis, which is as a result of increased levels of carbon dioxide in the blood. Paralysis is another complication, which is related to the deficiency of oxygen supply to the nerves. And last complication is recurrent infections, which are related to lowering of the immunity. Okay, so that's all. It means we've answered this question. Okay, so that's how you answer this question. Thank you for watching. Please subscribe.